Hi, I'm Selena Valenzuela, and this is week 7 patient case presentation. He came in with the chief complaint of saying he's here to follow up on his cholesterol or his lab work that his doctor wanted him to have. The patient's a 47-year-old, well-nourished male who's here to establish care. Patient states that he's feeling well and he's not having any symptoms of illness to report, and he's coming in to check on his last labs that he had drawn at his last provider. He just recently moved here, so he has not been able to be seen for about 6 months. He says he works as a driver and has for the last 10 years, so he has a pretty sedentary job, and he works really long days, so he finds it difficult to exercise. He says he gets sick occasionally with upper respiratory infections, but not anything that keeps him down for too long. He states that he's been trying to make the lifestyle changes he was advised to make, but it's difficult as he's on the road and eats while he drives. Patient says he's taken medication for blood pressure for 10 years, and his blood pressure has been under control for as long as he can remember. Patient was seen 6 months ago at his last provider just prior to his moving here, and he says he's here to establish care and to have new lab work done. We were able to obtain his last lab work from his provider, and what we received was that his lipid panel was drawn, and he had a total cholesterol of 275, an HDL of 35, triglycerides of 185, and his LDL was 204. Based on this copy, it's apparent he needs new labs just to recheck and see where he stands today. He doesn't have any known drug allergies or any food allergies or environmental allergies that he's aware of. He does have a history of surgery on his hand due to an injury back in 1990, but nothing else to report. He currently takes losartan 50 milligrams and hydrochlorothiazide 12.5 milligrams that he's been taking for the last 10 years that has kept his blood pressure under control. He's current on his vaccines, and he just had his flu shot a couple weeks ago. He reports that he has not had cholesterol problems before these labs that he can remember, but he is not always that great about going to annual visits, he says, because of him being away for his job. His social history is that he lives with his wife of 15 years, and they have 2 children, aged 12 and 15. He denies any tobacco or cigarette use. He denies or e-cigarette use, or any smoking, no drug use, drinks alcohol occasionally at social events. His diet, he tries to eat healthy, but his job makes it difficult, and he finds it easier to buy a fast meal. His wife tries to help him by packing healthy lunches as often as she can during the week. Due to his work, scheduling exercise is difficult, but he tries to take a walk on the weekends if he's home. He's sexually active only with his wife and reports no additional history there. His family history, his mother is healthy. His father has high blood pressure. He has his maternal grandparents, he says, are both deceased of old age or natural causes that he knows of. His paternal grandparents, his grandfather is still living who has high blood pressure. His grandmother is deceased as well and died of complications due to diabetes. His ROS, he denies any feelings of nervousness or any current suicidal thoughts. Said he feels tired sometimes. His skin has no rashes, no lumps, sores, or itching. He denies any bruising or bleeding, excessive sweating, heat, or cold intolerance. Denies headaches or head injuries or dizziness. No visual changes, does not wear corrective lenses. No pain, redness, excessive tearing, or double vision or blurred vision. His ears, he has no hearing change, no tinnitus, no ear infection or discharge. His nose, he has no sinus pain or epistaxis. He has no bleeding gums, dentures, sore tongue, dry mouth. His last dental exam was about a year ago. He reports no lumps or swollen glands or any neck stiffness, no syncope, seizures, weakness, denies any kind of numbness or tingling or tremors. He has no shortness of breath or no chest pain, denies any cough, denies any leg cramps, abdominal flank or back pain, or any pain in his arms or legs. He has no swelling in his calves that he reports, and states he has no muscle, joint pain, or any joint stiffness. His GI, he reports he has no changes, no dysphagia, no heartburn, no pain, no change in bowel habits, constipation, diarrhea, or any kind of food intolerance or indigestion, and he reports no nausea or vomiting. He reports that he has no pain, no dysuria, no hesitancy, nocturia, hematuria, kidney or flank pain. He is heterosexual and reports no history of sexually transmitted diseases. Objective, his vital signs are all within normal limits, including his blood pressure. It's 132/84 today. His weight is 205, and his BMI today is 29.4. His objective is skin is natural color. It's warm, smooth, and dry. He's got good skin turgor, no lesions, rashes, or moles. His nails are without clubbing. His no xanthomas. His skull is normal cephalic, and he has no carotid bruise. His eyes, his extraocular movements are intact. His conjunctiva is pink and moist. Denies any visual disturbances. His neck is non-tender. He has non-enlarged thyroid. His trachea is midline. Neuro, he is alert and oriented ×4. His thorax is symmetric with good lung expansion. His respirations are even and labored. No use of accessory muscles. No stridor, grunting, or nasal flaring. His lungs are resonant. His breath sounds are clear with no wheezes or crackles. His carotid has no bruise. His temporal arteries have normal pulsation without tenderness, no JBD, regular heart rate without any clicks or murmurs. His extremities are warm and dry without edema, and he has no varicosities or stasis changes. His calves are supple and non-tender, no femoral or abdominal bruise. His abdomen is soft, non-tender, non-distended, normal active bowel sounds, no palpable masses or hepatosplenomegaly. His kidneys are not felt, and he has no CDA tenderness. His muscles all are active range of motion in all his joints and upper and lower extremities, and no evidence of swelling or any deformities. His assessment. He has controlled hypertension. His blood pressure was 132/84, I believe I said. He has had this diagnosis for 10 years, and he is taking losartan 50 milligrams and hydrochlorothiazide 12.5 milligrams. He's going to remain on this dosage and this medication. Dyslipidemia is possible. From his last labs, it appears so, but they were over 6 months ago, and he says he's tried to make some dietary changes, but has found it difficult to do so. So that will need to be evaluated today as well. He says he's really tired, could be anemic. He'll have some lab work to confirm or deny that. Could also be his long hours behind the wheel and probably, or maybe some lack of sleep. So the plan for him is to have some lab work done. He's going to need a CBC, a CMP, a UA, and a lipid panel. He is going to remain on his blood pressure medication as is, losartan 50 milligrams and hydrochlorothiazide 12.5 milligrams. He does have a family history, and he's also of hypertension, and he's also been or had this diagnosis for 10 years. Dyslipidemia, going to establish where he's at based on his lipid panel. If it turns out that they're elevated, depending on where they're at, he may be advised to, well, he's already tried some lifestyle modifications, and we'll see where he is based on that. And it's a possibility that he may need to be started on atorvastatin, 40 milligrams once a day if the diet modifications failed. He is overweight. His BMI is 29.1. His sedentary job doesn't help that matter much. The patient's been educated that it's important to help control his blood pressure and to keep his cholesterol under control, that he needs to try to get some exercise and try to reduce his BMI and at least try to make as best effort as he can to eat some healthy meals, or to be able to see what healthy options there are on the road. He's been advised to try to get some exercise. A few minutes here and there throughout the day adds up. He's also been advised to return to the clinic in a week to discuss the lab values, make a proper diagnosis, and then establish a treatment plan after that. So the patient understands all of these instructions and has made an appointment for the following week after he has had this lab work done. Okay, that is this week's patient presentation. Thank you. Thanks for watching. Bye.